Hello, my name is Frank Sullivan, and I'm going to speak to you today about some work that we've been doing over the past few years on the early diagnosis of cancer of the lung, or ECLS. The work's been published in the European Respiratory Journal earlier this year, and it's based on the core scientific principle that whenever cell, in this case, an epithelial cell of the lower respiratory tract develops cancer, and abnormal proteins are elaborated on the surface of the cell, and that elicits an immune response. Autoantibodies are produced, and that can be captured using an ELISA technique against the common abnormalities that are detected. So this work was conducted by a range of Scottish universities and the University of Nottingham, as well as NHS Scotland and the Tayside Clinical Trials Unit. The basic idea within it is that any biomarker in cancer has through 5 stages, and the ECLS study was a collaboration between the company who produced the autoantibodies, OncoImmune, and Scotland's chief scientist. And it was a phase 4 prospective screening type of study. This means that the biomarker, in this case serum against autoantibodies, has gone through preclinical laboratory-based work and then gone on to be validated. And this was a prospective screening study where we had a bit over 12,000 patients randomized to be tested with the blood test or not. They were picked for inclusion because they had a history of smoking more than 20 pack years, and they were aged over 50. And these are the basic results. You can see the blue line here, which shows that the people who tested positive, they had quite a lot of early cancer diagnoses in the first 6 to 9 months, slowly flattened over time, whereas the people who tested negative and in the control group, there were relatively few lung cancers were diagnosed. Overall, the specificity of the test for early diagnosis was about 95%, as in the early stages, the sensitivity was over 70%, although that dropped as time went on. Because it's a trial, we can look at all-cause mortality, and we now have the 3-year data showing that all-cause mortality is substantially lower in the people who were tested compared to those who were not tested. Thank you.